Good morning, everyone. Thanks for joining us for our Focus Parent Workshop today. If you have any questions for our workshop leader, Catherine, please wait and add those to the chat box throughout as she'll be answering those questions, and then she'll definitely get to them by the end. Without further ado, it is an absolute pleasure to introduce to you Catherine with Legal Aid Atlanta and Healthful Partnership. Catherine, take it away.
Good morning. My name is Catherine Morris. I work for Atlanta Legal Aid, and I work in the unit which is called Health Law Partnership, which is a partner, which I'm going to explain. It's a partnership between Georgia State Law School, Legal Aid, and Children's Healthcare of Atlanta. And I am a parent of some children that have had some acute health issues. And so this is something that is personal to me. And I also was previously employed by Parent to Parent of Georgia, which is a sister organization to Focus. So I'm super happy to talk to you this morning about these services that we offer for low-income families. So what determines health? One of the reasons our partnership was really created was because it's become pretty much established now that health is determined not just by what everyone thinks, genetics, but it's also involves a lot of outside factors, some of which can be addressed through legal services. So what determines health? So 20% is genetics, 20% is healthcare, but a lot of it is life's living and working conditions and socioeconomic and cultural and environmental conditions. You can see that the the home that you live in, the access to services are huge factors in determining health outcomes. So, this is like a cute cartoon that just basically, you take the kid to the pediatrician and they say, oh, there's no ear infection. The ear infection's gone. But how's everything else? Well, here's the mom so worried about every other factor in their life, which is really, affecting the health of the child: heat, school, food, rent. So it's a significant issue that needs to be addressed, maybe not by the medical community, but maybe by an interdisciplinary approach. So why collaborate? Why are doctors and lawyers collaborating together? Because all of these issues, which I'm sure some of these acronyms are going to be familiar to some of the parents on this call, the waiver, DBHDD, Social Security, getting access to Medicaid, getting access to food stamps, getting access to healthy housing, getting access to special education services. These are all interrelated into helping the child. And these are things that we can help with in a way that medical professionals have barriers at some point. So what is the healthcare partnership? What is a medical legal partnership? And we're not the only medical legal partnership in the country. We're one of the larger ones, but it's integrating legal assistance into hospitals, and it's an interprofessional approach to help address social determinants of health to help people meet basic needs, and it improves the health and well-being of vulnerable populations. So our partnership is, again, between CHOA, Georgia State College of Law. They have a clinic that specifically services this program, and Legal Aid Atlanta. So it's staffed by legal aid attorneys. I'm employed by Legal Aid. And it's really a combination of researching what help really helps people, and that's Georgia State does a lot of that work. Systemic advocacy, so not just advocating for parents, but just advocating for change across the board as far as how food stamps are handled, or how Medicaid is processed. Also public health legal services, which is what we do directly, providing actual lawyers for actual legal problems to families, and then educating people and medical professionals and parents about the laws that are out there and what's supposed to be happening as far as access to the services that might improve the health of families. So see, these are some of the problems. This is a kind of a graph that shows some of the health conditions of the population that we help. A lot of people with asthma. We service all of the CHOA campuses. Developmental delay and autism are huge parts of our client population, especially as regard to educational, special education support services, ADHD, and you'll see it gets like lesser seizures, lung, GI, sickle cell. We have a big sickle cell center at Hugh Spalding Show Atlanta, so we do help a lot of sickle cell patients with their SSI, and other supports, prematurity, cardiac issues, blindness, and liver. So the referral threshold, you have to, we can't help every single person who calls, although we can usually at least give legal advice over the phone to anyone who calls. But in order to get a retainer for legal services, you have to be seen at Children's Healthcare of Atlanta or an affiliated institution. Marcus is one of our affiliated institutions, our rehab hospitals or urgent cares. The ED is like the emergency department, Center for Advanced Pediatrics, that's where my office is located. So if you're, if you've had a child that's been to CHOA, which is almost every child in Georgia, you have enough of a relationship to access our services. But you also have to meet our financial threshold, which is being less than 200% of the federal poverty level. Again, we can offer legal advice and referrals to people who are not meeting our financial threshold, but because we are funded by the federal government as part of legal aid, there is a financial threshold to be able to access our services. Our threshold is a little higher than the rest of legal aids, so we are not higher. It's easier to access our services than the rest of legal aid, and we are statewide, which not everybody legal aid is, but there is a financial component for us to offer you a retainer for legal services, which would mean going with you to a meeting or a hearing. Also, we have a case acceptance process where we actually meet as a team and discuss which legal cases that we're able to accept for a retainer or advice. Usually this is a function of, is it a legal problem that we have a solution for? Is something that we handle? Is this the kind of case that we do? That is the typical thing that we need to discuss. We meet on Wednesday morning. So if you get a call and it's Thursday, you may have to wait a week until we make a decision about whether or not we're able to take your case. So the legal problems handled, we do a lot of SSI appeals for supplemental security income, so disability claims for children. We do children, child's SSI, only pediatric SSI. We do a lot of referrals to family law cases. We do a lot of housing cases, evictions, and conditions cases. I'm going to talk a little bit about each of these in a minute. Special education advocacy, public benefits, including Medicaid, and then employment estates, consumer. We don't do that much of that. That's more referrals. So let me talk a little bit about education. This is one of our bread and butter areas. So some of the issues that parents call us with are the child has no IEP, even though they clearly have a disability and need an IEP, or the IEP is not adequate, or there's a beautiful IEP, but the school's not complying with it. A big call that we get a lot is this child is supposed to have nursing services in the school system, and the child's not been able to attend school because the nursing services has not been consistent. There is a nursing shortage, and the schools do have a hard time sometimes staffing, but if the child can't attend school because the nursing services are not available, the school is not complying. And so this is something we will get involved with as well. If the child's not in school at all, maybe the child was taken out of school for disciplinary reasons, or we've even had cases where the school has said, especially during COVID, the school has said, there's nothing we can do for them. You might as well just keep them home. Like, that's a violation of the special education law. So this is something that we will help with. We will go to the IEP meeting with the family. Initially we'll pull the records. Then often we will go to the IEP meeting with the family and then advocate for better services. There is a dispute resolution process within the Georgia Department of Education, and we do help with that process, although we try to work it out with the school directly first. A big thing and this is a typo, no evaluations within the last actually should be 3 years, not 2, I apologize. The schools are supposed to do evaluations every 3 years, comprehensive evaluations, educational, psychological evaluations. They've been better about doing them when we advocate for them. So this is a, if you're, but it's very often I get an IP where no one has evaluated the kid in 10 years, 5 years. Um, or the evaluation is, they'll have rubber stamped it. They've looked at the paperwork and said, well, we certify eligibility, but they haven't done an evaluation. That's not a good practice. It's not best practice. And a lot of times those evaluations, not only do you want them for the school services, but you may want the copies of those reports to access other support services like family support services or the now comp waiver, or just for other purposes that your child might need them. Maybe the child is just, you don't know what's not happening at school, but the child is freaking out and anxious about school and doesn't want to go to school. That's probably a sign that they're not getting the proper supports. And we can look into it and take a look at the IEP or the medical records and see if there are supports that should be in place that aren't. A very common thing is to see no behavior improvement plan for a child that's consistently being disciplined, or your mom's getting calls all the time to send them home. This is definitely something that we can help with as far as advocating to get behavior supports put in place, and have what's called a functional behavioral assessment done. Another thing that would be a violation of the special education law is if the child is suspended for more than 10 school days without a meeting. If the suspension is official, that is less likely to happen, but a lot of times there's unofficial suspensions where the parents getting called, come pick up the kid, and the school's not marking them absent. There is a lot of new guidance from the US Department of Education directing schools not to do that. And so there's less common than it used to be, but it's still happening regularly. So if your child is out of school a lot, for unofficial or official suspensions, and it's more than 10 school days, there's supposed to be a meeting where they really heavily re-examine the IEP. Another huge part of what we do is housing cases, where there are conditions in the house that are just not, not livable. There's a lot of mold in Atlanta. A lot of people will call us and say, oh, we're so sick from the mold. Mold cases are tricky. It's hard to prove that the mold is causing people to be sick. However, you shouldn't have to live with the mold in the house. Anyway, what we're being told by the doctors, and this is the beauty of a medical legal partnership, is that the rodents and rodent droppings are actually a much bigger factor in making people sick than mold. And so if you have an insect infestation or mice, and mice droppings, that's problematic and it's not safe for your family. So we, a lot of times we'll advocate with the landlord's attorney or the landlord themselves, not the property manager. We usually go above the property manager to see if we can come up with some resolution. Sometimes, it's a tough thing to do because in Atlanta, the housing market does not favor the tenants. And so it's hard to find new places to live if the one place is bad, but it's, we have negotiated to get people out of their lease early, if they have someplace to go. And sometimes we are able to negotiate for repair. A lot of times, hand in hand with conditions comes evictions. There are landlords out there that will do a retaliatory eviction, which even though that's legal, there's a statute, a law that says that they're not supposed to do that. But a lot of times, once the parents or the tenants complain or call code enforcement, landlords will come up with like a eviction with a fake reason. Or maybe the family just doesn't have the money to pay and they're getting evicted. We can try to help. It's help negotiate that to happen in a way that's less upsetting for the family. The last thing anybody wants is to have all of their stuff put out on the street when they have small children. So, we can try to negotiate the eviction happening on a timeline that the family can manage. Georgia is a tricky state because the duty to pay is separate for the duty to repair. So if you have not been paying your rent, even if you have a hole in the roof, the landlord can still evict you, which is not the case in a lot of other states. We definitely have people who come from up north and will move down here and be like, well, I withheld my rent because they didn't fix that. Well, you can't do that here because the landlord will evict you usually, and they will win at court, which is not the case in other states. So it's Georgia is not a tenant friendly place. But we can help and, and certainly we can advise with regard to these kinds of issues. Public benefits, we're getting a lot of calls about food stamps, SNAP. There is, the food SNAP is, the Georgia, Department of Family and Children's Services, DFACS, is in charge of administrating the food stamp program. They've had a lot of delays. They're sending out delay letters. The federal government is watching them because that's not supposed to be happening. So we can help. You call the DFACS for your county if your SNAP application has been delayed for more than 30 days, or denied for a reason you don't understand. That's something we definitely help with. And if you are denied and you disagree, it can be escalated to what's called a fair hearing. And we have gone with families to fair hearing about these delays and negotiated with the DFACS staff about food stamps. Medicaid is a huge issue. With the end of COVID, met a lot of people were kicked off Medicaid, some correctly, and some incorrectly. I got an email yesterday from a CHOA social worker saying this very ill child was just kicked off Medicaid. They definitely qualify. Can you help them get back on? Again, Medicaid is also administered by DFACS, so we will help, untangle problems with being kicked off Medicaid, or maybe the child's on Medicaid and the DFACS has denied, or the Medicaid provider, the insurance carrier, has denied coverage for a certain kind of procedure. We had a bone marrow transplant case where the provider had refused to pay. We were able to negotiate it and get a reversal of the position of the insurance carrier and get a procedure paid for. So this is something we help with quite a bit. And this is really the beauty of us having a relationship with CHOA, because I'm located, like where all of us are located within CHOA facilities. And so we know a lot of these doctors and have access to the doctors, because really without the doctors' support, it's very hard to advocate on to get some of these benefits. But where we're working together, we have better access to get the doctors to help us advocate and sign off on some of these things that we're trying to get accomplished for families. Adult guardianship and supportive decision-making. This is a very tricky area in the disability community. When a child turns 18, a lot of times schools and doctors will say to the parent, you have to get guardianship. That is not always the right thing to do for every situation. If the child has capacity to communicate and make decisions, guardianship is not necessarily the right option. There are other tools that are less intrusive. Guardianship involves taking away the right to get married, the right to enter a contract, the right to a lot of things. And it's sometimes just too intrusive and not appropriate. Guardianship for somebody with a mental health situation is very controversial. We don't personally at our unit or at Legal Aid do that. We consider ourselves disability community advocates. We're very proud of our legacy of protecting the rights of the disabled. So we're very careful about when we do guardianship. But we will help you with supportive decision-making and also accessing other services for adults. But very often financial power of attorney or medical power of attorney, advanced directives, or even an educational power of attorney will accomplish the goals that the parent is seeking, rather than a full guardianship, which involves going to court. There are times when guardianship is appropriate, but it's something that it's a very thoughtful process. I am going to make a plug for Parent to Parent, my old employer. They have a really great video on their website about trying to navigate the decision about whether or not guardianship is right for your family. And so I suggest you call over to Parent if you're trying to work through this, but you can also call us and we can talk to you about some of the factors in making a decision about guardianship. But we are very strict about capacity. We really we usually don't do guardianship cases unless the proposed ward is pretty severely disabled, like cognitive, cognitively and from a language perspective. Also, one thing that's tricky is because we're funded by the federal government, we can only support applicants who are citizens or legal residents. If the child is a legal resident or a citizen and the parents are not, we can, for most cases, we can still help. The one area that is tricky is when the parent wants a guardianship and the parent is not a documented person. And we cannot make the child, because it's a different kind of legal relationship. We cannot make the child or the ward the client in that situation. So if the parent is undocumented, adult guardianship is not something we would be able to help them with. We could talk to them about supportive decision-making and other options, and we definitely would refer them to other places that might be able to help them. We don't just tell everybody, tell too many people no. We try to always give them an option and someplace else to look. Supplemental security income, SSI, this is a big area for us. We do not help with the actual application for SSI, but if you are denied, which almost everybody is the first time, we will help you with your appeal if it's a good case. So this is, and helping with the appeal involves writing a brief and going to the hearing. It's a pretty complicated process. There are other attorneys out there that you could pay to help you with this, and they will take a part. And if you win, they will take a portion of the back pay that you're awarded. We're free, so we don't take anything if we do your SSI appeals. And this is something we're actually really good at. The clinic at Georgia State Law School, the professors who teach the law students are they're experts in this area, and they have students helping them, and they just have a high rate of success. And I've done a few, and my colleagues have also done a few, and this is a big area for us. The thing to know about supplemental security income is, there are certain disabilities that will automatically get you SSI. That's called the compassionate allowance. That's a gimme usually if you have one of those disabilities, but there's a lot of people who don't fit into that category. Either it's a rare disease or it's just not one of the ones on that listing, but it does give rise to a disabled child. Some of the ones that you have to meet certain standards, they won't automatically get you SSI, but if you have a certain level of illness like sickle cell, there's requirements about how many times you're hospitalized and how severe your symptoms of sickle cell are in order to get help. That's a common one that we do SSI appeals for. Asthma, again, not having asthma in and of itself will not get you SSI, which is, SSI will sends you a check every month in addition to giving you Medicaid if you're not otherwise eligible for Medicaid. But asthma, you also have to have a certain level of sickness from it in order to qualify for SSI. And again, like rare diseases, sometimes like I had a case where the child had a devastating diagnosis, but because it was such a rare disease, it wasn't one of the listed illnesses, but we were able to argue to get this child SSI under the whole child standard, which is Social Security will look at the 6 domains of how a child is doing with regard to self-care and health and in general. And so it's a whole analysis. And I've had at least 2 cases where I've won on the whole child standard, where the child really didn't fit any of the normal diagnoses, but overall there were so many things going on with this child, they were clearly disabled. And so that's another way to get SSI. So some of the things that we don't provide assistance with: initial applications for SSI, Medicaid, and SNAP. Those are not really legal issues. That's more of something that we hope that the social workers at CHOA, who are amazing, will help you with. Once you get denied, then we can help you fight to get it, but um, we're gonna defer to our friends at the CHOA social work team, to help you with the initial applications. Also parent to parent does give some guidance. I don't think they fill out the applications with you, but they'll give you some guidance on filling out the applications. We don't provide financial assistance. We get a lot of calls for people who need help with childcare, or, help with utilities. That's not, we'll refer you to other agencies. We won't just, send you away, but we don't have a budget to help pay for basic needs. We don't really take too many Katie Beckett cases. If you're qualifying for Katie Beckett, you probably, not always, but you probably are not going to qualify for legal aid services. And so we really don't get too involved in Katie Beckett applications or denials for Katie Beckett, because of that. But Parent to Parent has beautiful resources for Katie Beckett applications, and I'm sure Focus can help you as well. Things that we do not do, but we will refer, we have quite a bank of referrals, is medical malpractice. We really don't, because of our relationship with CHOA, we're not going to represent a family trying to sue CHOA for a medical malpractice. It's not what our office does, but there's plenty of attorneys out there who will do it. And we can provide you with a list. We do not do custody and child support cases in our unit. That doesn't mean to say that legal aid won't do it, but not in the health law partnership unit. We don't do wills and trusts. Again, there are some probate court clinics that we can refer you to who might be able to help you with it. And I think there's a new organization, Black Women Wills, who they're having an event in November, but we'll refer you to some place like that. I do want to take a minute to talk about personal injury cases, because you don't need to be high income to pay a personal injury attorney, because they usually just take a cut of what you win. We don't do personal injury cases. Anybody usually can find, no matter how little money you have, can find a personal injury attorney. We get a lot of calls for people wanting personal injury claims based on mold in their apartments. We do not do that. It's very hard to prove that mold is related to asthma and breathing conditions, but because it's a personal injury case, we'll refer you to, you can find, you don't need legal aid to do that. You can find an attorney who specializes in that kind of work who will take that case. There is all law firms that even specialize in mold personal injury cases. Again, other things that we do not do, but we will refer often within legal aid, is adult SSI, so adult supplemental security income from Social Security. We only do pediatric, but we have a whole bunch of people at legal aid who do adult. So we will happily refer you to those. If your child is over 18, it's not going to be our unit, but there may be another unit at legal aid that can help you. We do not get involved in denials of now comp. Typically, we have another unit at legal aid that does a lot of that work. Again, because now comp is really an adult, not necessarily on paper, but in practice, it really is usually adults who are grappling with now comp, because the wait list is such that they don't let too many kids off the wait list. And we're really a pediatric focused unit. Temporary protective orders for domestic violence. This is a big thing for legal aid, but not for our unit. We don't necessarily, we're really focused on the safety of the child, and less involved with the spouses and domestic violence issues. But we will certainly be very aggressive about referring you to somebody, because it's something that legal aid is very concerned about. So I do want to talk about some of the specialty units that you would possibly get referred to for some of these issues. These are units that do nothing but this, or I shouldn't say nothing but this, but that really specialize in some of the problems that families might be encountering. We have the kinship unit. Kinship unit was created because there were so many abandoned children that the legislature funded a program to help. It's a lot of, in practice, a lot of grandparents raising grandchildren, or family members taking, or people who are acting in the place of acting as family members, even though they're not biologically related, helping them formalize those relationship. So that's what we call temporary guardianship, because it's guardianship for children. It's temporary because it ends when the child is 18. But if you are looking to get guardianship of a child that is not biologically yours, and again, it's almost always grandparents, the kinship unit does a lot of this work and they're experts at it. And we just work very closely with them and can't say enough great things about them. But a lot of times people will take in family members or friends' children and never formalize it. But then maybe because of SSI or other reasons they want to formalize it, need to formalize it. This is the unit that can really help them. The Disability Integration Project, this is a unit that helps with a lot of disability issues for adults. So if your child is over 18, the DIB is a great resource for your child. They do help with now comp, not so much the applications, but with if you're denied, to show that, to establish that you do qualify for the now comp waiver. They help with adult SSI cases, and they help navigate when adult Medicaid issues, if Medicaid is denying coverage or a service. They are wonderful, and they are, you know, they exist purely for adults with disabilities, and they're a great unit. So we also have our general law units. So some of the other things that I touched on that we don't do so much of, like domestic violence, custody, divorces, family law, adult book. Maybe you're just an adult who needs having problems with their SNAP and there's no children in the house, or needs help with Medicaid. If you live in one of these counties, Atlanta Legal Aid will help you. The downtown, our main office is on Ellis Street. That's for Fulton County. We have the South Side office. I mean, in Clayton, they are great too. They know the tricks of Clayton County, and obviously Cobb and DeKalb and Gwinnett. If you live outside of these 5 counties, Georgia Legal Services Program has the grant to provide free legal services. So there are legal services, they're just not part of Atlanta Legal Aid. Atlanta Legal Aid is really Metro Atlanta. And we've been around for 100 years. We just celebrated our 100-year anniversary. So we're very proud of that. So we are located at all of the CHOA hospitals. We are hiring for the position at the new Arthur Blank Hospital, so we don't have anyone in that office, which just opened up yesterday or Sunday. But I'm at the Center for Advanced Pediatrics on in Druid Hills and area, and then the legal director, my boss, Pam, is at an office building right next to Scottish Rite Hospital. You can walk to it from Scottish Rite. Alexander Sanchez is at Hugh Spalding downtown, which is right by Grady. And then we have the Legal Services Clinic at Georgia State, and they're fantastic and help us a lot. So here's our intake line. If you need legal services, my recommendation is this: you call this number, someone will call you back and do an intake, ask questions about your financial eligibility and your legal problem. That's the best way to get a hold of us. You know, you can also go to our website, healthlawpartnership.org, to learn more about us. I think that there is a contact form on there as well, but really I'm going to recommend that you call us. I think that's the best way to reach us. So that is the presentation. I did want to leave time for questions. I hope I didn't go too quickly. But I really appreciate all of you making time to be on the call this morning. I don't know, Jade, if you want to, you know, we're not a huge group. I don't mind people just unmuting and asking questions, or you can put it in the chat box. Just be mindful that this is being recorded. So I'm going to be limited in amount of, you know, if you need hardcore legal advice, you might be better off just calling us directly. And I do want people to be aware that, again, it's being recorded. So if you're sharing private information about your family, be aware of that.
Yes, Catherine, thank you so much. Anyone that has any questions for Catherine, please feel free to unmute and ask. Just as she said, remember to keep your personal information covered up, because this is being recorded for other families to watch. But anyone that has a question, so one question in the chat is, can you still apply for SSI if you're receiving Medicaid as a secondary insurance?
Yes, and I think that what will happen is that your Medicaid will change to SSI Medicaid. So the Medicaid, the coverage might change slightly, but you would still, you should certainly still apply because SSI gets you a check. And it's, it can be like between $700 and $900 a month for the care, for the child. Um, so yes, you should certainly still apply.
Thank you, Catherine. Yes, any other questions? Feel free to unmute or add those to the chat.
You did mention income eligibility. What is the cap or the maximum amount of money you can make before someone qualifies for your services?
It's a tricky question because it depends on the number of people in the household. So it's the better thing to do is to call us and we can run it through the spreadsheet because it's not just, there's not a black and white answer to it. So, yeah. So I'm sorry to it's to hedge,
We like gray answers too. That's
Yeah,
okay. That's not a
mhm.
yes or a no, but that's a
Yeah,
maybe.
but call us and we can tell you pretty quickly. Yeah.
Any other questions?
Yeah. And even if you don't qualify, we'll give you, free legal advice. Like we'll point you in the right direction. It's not like we just say like, no, good luck, have a nice life. I have people call me all the time who are over income. Some of them, shouldn't say it, some of them way over income and still call me. And I can't go with them to a hearing but I'll answer questions.
So I did have a question. I guess I missed it. What's the contact number?
Oh, I can go back on the slide. It's 404-785-2005.
Thank you.
Yeah. So probably you'll end up leaving a message and it might take us a day or two to call us back. We get a lot of calls. But somebody will call you and we will do an intake, the intake takes about half an hour. And because we have to ask all the financial questions to see if you qualify, and then go over what your issue is. And again, even if you don't qualify, we'll give you some advice or certainly refer you to either private attorneys or other people who do that kind of work or other agencies that don't have income caps.
Thank you, Catherine. I like if they don't exactly qualify for the service, you can at least give them, resources to follow up with. That's wonderful.
Yeah.
Okay, last chance. Any burning questions that you have for Catherine?
And it's back to the SSI again. Are you able to, I know I've heard in the past that you can receive SSI for different children, and is that based off of income?
SSI does have an income eligibility component to it. So if you have too much money, you will not qualify for SSI. And then the option becomes Katie Beckett. So if you make too much money or have too much money in the bank or whatever, and you get denied based on income, even though your child is very disabled, if their child has is at a level of requiring an institutional level of care, but for you, then you can apply for the Katie Beckett program, which would get you Medicaid. You just won't get the SSI check. So you get Katie Beckett Medicaid, and Katie Beckett is a very onerous application. And if you end up doing that, I suggest you call Parent to Parent of Georgia. They have a beautiful Katie Beckett video that Debbie Dobbs did about how to apply for Katie Beckett. It's 2 hours long. It's not the most exciting thing I've ever sat through, but it was super informative. And they have cheat sheets and a lot of resources about applying for Katie Beckett. But again, if somebody calls us up and they're like, well, we're on Katie Beckett, that usually for us means they're not going to qualify. And so again, I'll answer their questions, but we don't do a ton of it because they're usually, if you can't qualify for SSI because of your income, you're probably not going to qualify for us either.
Okay, thank you. I'll probably give you a call because I have more detailed questions. So
Yeah, call us anytime for sure. Yeah, that's what we do.
Well, Catherine, we can't really thank you enough for walking us through everything that the Health Law Partnership does, how you're serving our community, thank you for giving us your morning and your knowledge. We
Well,
appreciate
thank you for having me, Jade. I love Focus. I just think that they're fantastic. And I think I'm going to probably try to come to the fair that Focus has in the winter time. So I'll see you again. And if anybody, from this call comes to that, I'll probably be there and you can come chat with me.
Yeah, that's perfect. Anyone that's joining the holiday party with Lego Tech is welcome to come and see Catherine and ask all the questions there. So thank you, Catherine. Have a wonderful day, everyone.
Thank you.